Do you know what HIV and AIDS are and how they affect the human body? Well, let's delve into this topic. HIV, or Human Immunodeficiency Virus, is a virus that launches an attack on the immune system. Its primary target? A group of lymphocytes known as T helper cells. These cells play an instrumental role in helping the immune system combat infections. When left unchecked, HIV can escalate to the disease known as AIDS, or acquired immunodeficiency syndrome. So, how does one contract HIV? The virus is primarily transmitted in three ways: unprotected sexual intercourse with an infected person, sharing needles or syringes with an HIV-positive individual, and from an infected mother to her child during childbirth or breastfeeding. It can also be transmitted through blood transfusions or organ transplants from infected donors, though this is now rare due to rigorous screening procedures. Once the virus enters the body, it begins its destructive work on the T helper cells. As these cells are destroyed, the immune system progressively weakens, making the individual increasingly susceptible to opportunistic infections. These are infections that seize the opportunity of a weakened immune system to strike. In the initial weeks after exposure to HIV, some people may experience flu-like symptoms, including fever, fatigue, and swollen lymph nodes. However, these symptoms are not universal. Many individuals with HIV may not display any symptoms at all. If HIV goes untreated, it progresses to a chronic stage. In this stage, the immune system continues its downward spiral, but symptoms may not be readily apparent. AIDS is the final stage of HIV infection. It materializes when the immune system is severely damaged and the count of T helper cells falls below a critical level. Once a person with HIV develops one or more opportunistic infections or certain cancers, an AIDS diagnosis is made. With a severely compromised immune system, individuals with AIDS are highly susceptible to a variety of opportunistic infections. These can range from tuberculosis and pneumonia to candidiasis, and these infections can be severe and sometimes fatal. Certain cancers, such as Kaposi's sarcoma and lymphomas, are more likely to occur in people with AIDS. Wasting syndrome, severe weight loss, weakness, and a decline in muscle mass is another common symptom. HIV can also affect the nervous system, leading to conditions like HIV-associated neurocognitive disorders and AIDS-related dementia. But there is hope. Prevention measures include 1. Safer sexual practices such as avoiding multiple sexual partners and using condom during sexual intercourse. 2. Implementing needle exchange programs for people who inject drugs to exchange used needles or syringes for new sterile ones and become educated about the dangers of sharing them. And 3. The use of antiretroviral drugs as pre-exposure prophylaxis to prevent HIV transmission. The standard treatment for HIV is antiretroviral therapy. This regimen helps control the virus, slow the disease progression, and prevent opportunistic infections. Early diagnosis and consistent medical care are crucial for managing HIV and preventing it from progressing to AIDS. Thanks to advancements in medical research and treatment, outcomes for individuals living with HIV or AIDS have significantly improved. With early detection and proper medical care, many people can lead healthy lives. Thank you for tuning in.